Oh my goodness. Well, this is super exciting. I'm so stoked to be here with the amazing Chris Ells and we're doing this as a video deal to connect with each other. And so, yeah, man, I don't have a terrible amount of agenda for what we're going to do for today, but I would say, hey man, what up?
Yo, what up?
What up,
No,
man?
this is great. Thank you for having me. And yeah, this is my first podcast. So really exciting. And yeah, I like being interviewed about this stuff. It's part of my narcissism. So
Totally.
really, really looking forward to sharing. Yeah.
Well, the feed into that narcissism, man. I'm sure this will be first of many for you.
It's a what?
Yeah, I'm sure this will be first of many for you on the podcast world.
Yeah, I hope so. Yeah. Nice.
Yeah, cool. Well, so like, let's just kind of get into this. Like, let's learn a little bit about you. So, Chris Ells, Dr. Chris Ells. So, tell me a little bit about your background. You are an acupuncturist, a doctorate of acupuncturist. You do this amazing massage-based techniques called Yin Tui Na. But let's hear a little bit about your story. You right now are in Santa Cruz.
Hmm.
Yeah, great. And you trained in Chinese medicine. So let's get back to your beginning. Let's get into like a little bit of your origin story about who you are, how you came to be who you've become, and get into like the
I haven't
details of all
figured
that.
I haven't figured any of that stuff out yet.
Well,
But
maybe
I
this
can ask.
podcast will be
I
that
can answer.
discovery.
Yeah, right.
Yep.
I can answer like historical questions and stuff.
Yeah, totally.
Yeah, uh, I came out here from the East Coast. I'm from New Hampshire, from a small town in New Hampshire.
Hmm.
That unfortunately it doesn't rhyme with hick, so I can't be like Larry Bird, the hick from French lick, but it's virtually the same idea.
Uh-huh.
And I got interested in healing when I was really young.
Mhm.
Um, I don't know if it had anything to do with it, but I was a forceps birth, and they had to try to pull me out several times. And I don't know, just watching the way medicine was being performed around me all throughout my whole childhood. And also, my father had his arm amputated when he was 5 years old,
Oh,
and so I'd heard that story my whole life. And the key to the story, which always was a little bit jarring to me, was that had he not lived in a backwoods town in New Hampshire at the time, which that would have been 1945, the summer of 1945, and had they lived like closer to Boston or something like this, where they had the technology and knew how to deal with infection, he wouldn't have had that gangrenous infection that had to be amputated.
wow.
And he had to have it amputated more than once. I can't remember whether it was 2 or 3 times, but imagine a 5-year-old kid, right?
Yeah.
So that kind of stuff so I was always thinking about that stuff from an early age, I think. So that was always really interesting to me. And, we when I was in, say, around 20 or so, I had my first massage. There weren't really very many massage therapists around in New Hampshire in 1990, we'll say, So that all was pretty interesting to me. And I was doing a lot of Tai Chi and meditation because I lived at a Zen center for about 6 years, starting when I was 20 years old.
Hmm.
And the thing that was really interesting, not only in myself, but everyone who came there, even for a short period of time, but especially people who came to be long-term residents,
Hmm.
like myself, they would change somehow just from the practice. And this is before getting any kind of treatment, right? Just from lifestyle
Hmm.
change. And we didn't have any specific kind of diet or anything like that. We didn't eat a lot of junk food. It
Hmm.
was just healthy, normal food, nothing that cost extra. Actually, it was very inexpensive food in
Hmm.
order for us to have extra time to spend on Zen practice and actually Tai Chi as well. But watching my whole self change physically, emotionally, mentally, just from that kind of thing, that was very, very interesting to me. And actually decided to pursue an education in acupuncture before I ever even had an acupuncture treatment.
Mm, wow.
Yeah, because I had been reading Tai Chi magazine, which was a really quite well put together monthly, I think it was, periodical. Maybe it was bi-monthly, maybe monthly magazine about Tai Chi that my Zen teacher got. He would just read it, and he would let me read it as well, because we were doing a lot of Tai Chi as well.
Mm-hmm.
And that they often talked about Chinese medicine, and they're not really in depth so much, but I was like, oh, so that's related to this, at least tangentially, or something like this. Yeah. But I like to point out that what I was observing was not due to treatment. Okay, that first stuff was all just lifestyle. That was lifestyle, right? Yeah, just meditating every day and doing the regular Tai Chi practice. People would change, their whole way would change to a much more balanced state. Balanced humans.
Mm-hmm.
Yeah. So that's the main thing. And then I heard that the best schools were on the West Coast, and that Five Branches was, at least at the time, one of the top, if not the top, as far as all that goes. But I didn't really care about who I studied with and everything, because I worked at Dartmouth College for a number of years. I even took a bunch of classes there as an employee. And I also have taken classes at a community college. So comparing Ivy League to community college, not much difference. Sorry, folks.
Mm-hmm.
So I realized that it wasn't about, I didn't really care about all of that extra, surface level, status or whatever, that kind of thing. I just wanted to learn more about the medicine.
Sure.
And I didn't even really think about like having a practice in the future, although I felt like something that would fit my personality or, whatever pretty well, because I tend to like people for the most part. So, and one-on-one, they're okay. So that works out pretty good.
Yeah, cool. So tell me, what was the year that you connected to Five Branches over in Santa Cruz?
Yeah, so I moved out here in '98, in the summer of '98, and started in the fall of '98.
Yeah.
And then my class was the class that graduated in the fall of 2001, but they call us the class of spring 2002 because that was the fall that there was the 9/11 attacks.
Wow.
So they didn't. I guess it's some superstitious thing that you don't want to be the class that graduated. But that's me. That's my class. Yeah.
All right. Well, this is a good moment for us to sort of catch back up on, because Chris and I met when I was in Chinese medical school at Five Branches, and he had obviously graduated around the 2001, 2002 kind of time frame. And I come into Five Branches about 7 or 8 years later. And so he's there as one of the professors, one of the clinical supervisors, and that's how we actually connected. So Chris served as a mentor for me, as an educator for me during my early stint, and actually at the early part, and then all the way through Five Branches. And that's actually how our connection really established was Chris was an amazing practitioner of a particular art that I'm excited for him to share a little bit more about. And we'll kind of get into that, and we'll talk a little bit more about our experiences together. And so great. So, your experience with working at Five Branches, doing Chinese medicine, never really actually having a acupuncture experience or a treatment on yourself, but yet feeling it through the experience of whatever it is that you were kind of gaining from lifestyle-based support. And so, yeah, let's get into that. So what is this special technique that you connect to and offer, and tell us a little bit more about your relationship to it?
So the Yin Twin On.
That's right.
Yeah. Okay. So that was actually the first treatment that I ever gave anybody, was Yin Twin On.
Yeah.
And it was before, I've been practicing it for about 6 years before I came to Five Branches.
Mm-hmm.
And it didn't have a name.
Mm-hmm.
Yeah. Actually, I heard about it a few times before I actually even practiced it. I heard about it. I'll tell you those little stories. But then, just to tie it in with go back to how you started that question about when I came to Five Branches without ever having the acupuncture, right? So I was like, okay, so they just stick needles in, but it's working with the same energy,
sure,
right? So it's like, all right, so it's just needles, whatever, same, I want to understand the theories about, how the energy flows through the body, basic Chinese medicine stuff.
Yeah.
And, so the Yin Twin Ah, which back then I didn't even have a name for it, right? So the first story that I heard, it's hands-on, just using your hands, right? Uh-huh. So we call it Yin Twin Ah, whoever came up with that name, whoever it was, came up with this name, Yin Tui Na. Tui Na already existed as a name, and that's been around, probably that name's been around for hundreds of years or something, I don't know. It's Chinese for like push and pull or give and take or, move. And Na usually means like grasp, grasping. Like they use Chin Na is like joint locking, joint locking like in martial arts, right? So it's the same Na. It's like seizing, and then the other one, Tui. So it's like yin and yang in the name, Tui Na, right? But it implies Chinese medical body work or massage, Chinese medical massage.
Yep.
And the thing is, regular Tui Na, like if you were going to go to just about any Tui Na class on the planet, they would teach you how to do like rolling, right?
Yep.
Plucking,
yep.
Kneading, and how to use different, right? And one finger. Those are the four main things. And my understanding is that nowadays, because maybe it's at least correlative with the fact that Tui Na is being, from my understanding, I could be wrong, but I've had firsthand accounts. So just hearing secondhand from people who've gone to China, that the Tui Na has really taken a back seat in the overall global standardization of medicine.
Sure.
Which of course has hit, has stricken Chinese medicine, right?
Sure.
So our school was called Five Branches, right? For the five branches of Chinese medicine. So I often joke that Tui Na is like the broken branch,
right,
or one of the discarded branches,
right?
You can't make as much money. You can't make as much money off it, so that's not going to be part of our standardization package here.
Well, see, that's the funny thing about it, right? Like, so we go to school and we're trained in traditional Chinese medicine, TCM, but yet we come out with licensing in acupuncture, or at least go through the board exams and like get licensure. And so it's not really that we're acupuncturists, but that's one form of it. So this is what I found to be really interesting in just the world of people, just to give people a little bit of insight around Chinese medicine and the Chinese medical world, because what Chris is talking about is modernization of Chinese medicine and what we have access to. So most Chinese medical schools are trained in primary care style practice. And our primary care style practice, so we don't have a lot of hospital exposure, we don't get residencies, we don't have that kind of level. We're dealing with people who are coming into the office. It's usually fee for service. And our skill sets are actually highly trained in herbal medicine and getting into formulas. So 3 semesters of herbs, which is probably about 300 individual herbs that we study. So we learn dosages, we learn identifications, we learn contraindications and cautions. And then we have a solid another year and a half or 2 years of formula study, which is the combination of specific herbs from multiple schools of thought. The oh my goodness, the Jingui Yao Le, the Wenbing schools, the Shanheng Lung schools. And so these are 2,000-year-old textbooks that have been translated for us into English, that we are getting them. And they often are very diverse in terms of their perspectives because their diagnostic patterns are different. But herbal study and formula study for us is a way in which we can get this study of internal medicine. So physiology and then pathophysiology, and it kind of guides us into that direction. So actually our main study in Chinese medical school is herbal and formula based, but we graduate with that. So that's one of the main branches of Chinese medicine, but we get licensing in acupuncture.
And then patients don't want to take the herbs.
Yeah, and then patients and the compliance around herbal medicine is really kind of complex as well. And so then it's like we're not trained as sophisticatedly in acupuncture as we are in herbal medicine, but yet we graduate with acupuncture being the main aspect of what people come to see as our main marketing component. And acupuncture is even then not as high of a branch as, say, herbal medicine and formulas, because they have such an internal medicine quality. There's a lot of change that can happen. But on a real broad stroke of it, I mean, based on what you're saying, Chris, like one of the big things that I found in Chinese medicine is that it's not ideally it's not a treatment methodology. It's a way of thinking of the body in an integrative, holistic mind, body, spirit continuum that are utilizing subtle force, subtle energy to adjust ways in which we have patternization within flows of energy in the body. So chronic pain is not just oh, I have like ligament damage, or I have, shoulder damage, or I have, issues with muscle tear. We're talking about flows of energy that are created an imbalance that we want to correct. And if it doesn't maintain, if it doesn't get corrected, it becomes chronic because the flow of energy moving through there. And there's a lot that I know that you can go into this and really spell it out. And I'm just giving people sort of a basic point of view. And so Chinese meridians, acupuncture points, it's not just acupuncture, it's a system of way of thinking about it. And then, the next level is, well, how does Chinese medicine and allopathic medicine work when you talk about microbiology and cellular metabolism and the liver, the lungs and tissues and so forth. And, the way that I would sort of talk about it would be a much larger scale, where allopathic medicine gets very microscopic and Chinese medicine and energetic medicine is about macroscopic. We're learning about patterns of nature and harmony and utilizing a different skill set. So while it's the same body, it's a sort of a different facet of the mountain or a different facet of looking at it. And so, right. So the 5 branches of Chinese medicine: acupuncture, herbal medicine, Tui Na, body work. 2 others?
Diet,
of course.
and exercise. In other words, like energetic exercise, like Qigong or Tai Chi.
Right. And so obviously the things that people most know about in the Chinese medical practitioner world is acupuncture and herbal medicine. We're trained probably the most. I mean, the most amount of classes that we had is in herbal and formula-based medicine, botanicals. And then these 3 other branches are sort of like, they're out there on the side. And like you said, Tui Na is one of those ones. It's like, people don't really commercialize for it. And so that is just a foundation. Keep going with what you're talking about.
Yeah, no, beautiful. Thank you. That's great. So I'm going to cut ahead to now.
Yeah.
Where I'm at now is seeing in hindsight that probably you were just talking when we were setting up about how you like things to be streamlined and to be very simple because they're more enjoyable that way.
That's right.
And so with learning all this stuff, right? And then seeing, like with the herbs that patients don't want to take them after all anyway, and acupuncture, and how poorly it's taught. I'm sorry, I had to say it. It's taught poorly. Yeah. I mean, I'm going to tell you some stories about that too. Not to badmouth anybody or anything like that, but just to, as an adult conversation, what can we do from here to make things a little bit better,
Sure.
going forward into the future for future generations and so forth.
Yeah.
And so I've been so disheartened by the whole thing, having a pretty insider view, that I'm really happy that I stuck with Tui Na.
Yeah.
And I just do Tui Na and acupuncture. Sure, I understand the herbs and I prescribe them when people are willing to take them and everything. But, I'll tell you one thing. When I had a friend who graduated from Chinese medical school in America, got a good education in that, and then he went back home to Europe, and then he went to China. I met him in Europe, and he went to China, to Beijing, to the acupuncture school in Beijing, and he was going to get a PhD there, but he left in disgust because he actually became at least somewhat friends with some of the older teachers there.
Sure.
And they were communicating to him their dislike of the way that things were turning out to be standardized.
Yeah.
Yeah, and they were one of their big complaints. He kept saying, he would tell me, like, those guys would love you because they always talk about how the Tui Na guys are the ones who really understand how to work with a body.
Yes. Yeah.
All right. I'm not trying to diss theory or anything like that, but as far as really applying theory, like understanding what that feels like in your patient's body and your own, sure, you can learn that way too. But when you're working on somebody with your hands, you start to realize, oh, those are just words. Somebody didn't just make that up 60 years ago. I guess it's Chinese medicine is 65 years old now or something like that.
65.
The traditional one.
Oh yeah. Yeah, exactly.
Traditional times are right. That's another question I asked this whole thing, it's kind of very interesting. But it's the way I see it is that, so these guys, these old Chinese masters talking about how, it's just insane how they're not including Tui Na that much.
Yeah.
They do include it now, but it's almost like a museum piece.
Yes.
The school that I studied at in Hangzhou briefly, they had, you know, in a lot of the hospitals in China, they'll have a Tuina wing
Yeah.
in the hospital. It's part of the hospital, right?
Yeah.
Here, we don't even, like, acupuncturists here don't even want to do it because they can't make money at it, right? You
Well,
know?
right, exactly. Because in the massage world, that's more thinking of like a luxury or a spa. And, you go to a resort and you get a massage treatment, but to utilize massage not just for relaxation, but for actual therapeutics, for the treatment of disease. For so
Yeah.
let's get
And
into
it's
the
not going to look the same as a Swedish massage. It's
That's
not
right.
going to look the
Or like a
same.
deep
It's going
tissue.
to, or like a what? Deep
Or like
tissue, right? Right. Although sometimes it can get deep tissue, sometimes it can. And I want to also right up front be really clear for people who are listening, so they understand that I'm not just talking about body work on injuries. I'm talking about internal illness. I've
Yeah.
seen some major things turn around, like some pretty severe, oh gosh, digestive issues, really severe COPD with a lung infection that antibiotics and steroids couldn't even abate at all, and they put the person on multiple things. They got a week of Yin Tui Na with me, and they were already a lot better. Came back in a couple months later for another less than a week, maybe like 3 or 4 days, probably like 5 treatments within 3 or 4 days.
Yeah.
And after that second one, they were feeling really good. This guy was in his 70s, had smoked 2 packs a day for 40 years, right? He hadn't smoked for a while, but his lungs were toast.
Totally.
And not only did that cold or that lung infection go away, by the end of those two week-long sessions that he got, he was feeling really good. And I would sometimes get down to his old sacrum hip injury from like 30 or 40 years prior that had always bothered him. Just when his lungs felt like they wanted a little break, I'd just go down there and work there. And then that pain was gone too by the end of that. And then like 6 months later, like in the winter, the next following winter, his wife emailed me and said, oh, he's doing so well. He hasn't even gotten sick again since then.
Wonderful.
And usually he gets colds very frequently.
Yeah.
So, and that's just with 2 weeks of treatment, maybe five or so treatments within a week. And then 2 months later, another set.
Yeah.
And that was it, because they live far away.
Yeah.
So that's just one example. Post-stroke, I've worked on a number of post-stroke patients. Yeah. Amazing how fast they can recover. This is the thing. Modern medicine, Western medical science is talking about all this brain plasticity, right? Let's use it.
Yeah.
Why not? I mean, here I am, and I've got a bunch of students now, yourself, and a bunch of other ones who are actually practicing as acupuncturists. And
So let's get into that. Let's talk a little bit about Yin Tui Na. Like, obviously some amazing success stories. I've experienced it myself. I practiced with it for a number of years and have seen remarkable things just with myself, with people I work on. And so let's get into a little bit of your genius and your brilliance about this. So Yin Tui Na. So we know that Chinese medical massage, Tui Na, is an effective form of treatment, not just for injuries or for relaxation, but for internal medicine-based disorders, utilizing Chinese medical theory to be able to incorporate a vast sophistication way of a hands-on based approach to treatment. Mm-hmm. So let's talk about the yin aspect of Yin Tui Na and your real specific specialization within this particular work that gives you really a lot of clarity and insight around the body and therapy and treatment from the point of view in which you really face it. So let's talk about a little bit about that. Let's get into the nitty-gritty about that.
Yeah, okay. So the difference between those more active techniques that I was showing you, where it's really quite active, and then they do stretching and stuff, and and they can get pretty aggressive, really. Like it's a pitfall, I think, that people can fall into, being more aggressive than they need to be.
You mean like
and I
forcing tissues?
And I'm just saying, then they, pardon?
You mean like forcing tissues in a place where they're
like being a little bit
be ready to receive it.
Yeah, right. Exactly. That kind of thing. Yeah. Yeah. Just trying to rush it. And I'm just speaking from my own experience of having really taken the time, like insisted on taking the time and letting the body cook it out itself. Right. Mm-hmm. So my whole my whole approach is that I'm never trying to get anything to happen. Okay. Doesn't sound like the kind of doctor you want to come to, right? But at least I'm not going to hurt you because I'm not doing anything extra, right? At least you're not going to get hurt. And this approach gives your body the chance to do the healing, right? If a person studies, pays attention, practices it a little bit, you get a sense of where the body needs to be physically supported in order for the body to be able to do its healing. This whole concept of being a healer, it's really a bit of a misnomer. I mean, because we're not the ones that are doing the healing. You know what I mean? I mean, it's like healer, one who helps other people heal is maybe a better definition of it if we're going to keep using that word. I don't really have a problem with the word itself, but what it means, it sounds like, oh, I'm going to go around healing people out. That means I get to choose who gets to get better. I don't need that kind of thing. Plus, I realized that no matter what happened, what kind of treatment somebody gets, no matter what kind of treatment somebody gets or doesn't get, if any healing happens, it's being done by that organism.
Yeah.
That organism, mind, body, whatever, creature, whatever, has innate capacity to heal.
Yeah.
And nothing can make that happen. Right? If you can put a pill in but that's only going to change things for a little while, right? And then you're going to have to take another pill, right? Because it's working with whatever the function, the physiological function is, right?
Yeah.
But for the body to get out of the patterning, like you said, or we could say ill pattern or patterns of, I like to call it patterns of illness or injury.
Sure.
Mental, emotional, or spiritual. That covers pretty much everything. Just saying it that way. Injury or illness, mental, emotional, or spiritual. And the thing is, just by touching something, right, that's a little bit of an oversimplification because you can't just go up to somebody and touch them however you want and expect that to encourage healing, right? There's a little bit more to it. But we've all done, anybody who has two hands has done yin tui na because we've all stubbed our toe. What's the first thing you do when you stub your toe? Bad, right? If it's not that bad, you might not do it. But if it's bad, you're going to grab that thing as soon as you can. And you know exactly where to hold, exactly how to hold, exactly how much pressure, exactly where to put every single finger, exactly where to press a little bit more and a little bit less in your static hold, positioning off of your hands. Yeah. And when you get in that right position, you kind of don't even want to move, right? But you certainly don't want to let go. Okay. Trauma, right? Common word being used nowadays, trauma.
Yeah.
Okay. So think about like EMTs, right? Emergency medical technicians, right? When they show up at a place where there's been a really severe trauma and people are like freaking out. But what do? They give them blankets, right? To wrap around. Doesn't matter how hot it is outside. If you get wrapped, then you already start to feel like you don't have to keep going at that panic rate.
Yeah. Okay.
Right. And so we can say, well, why does the body need you to touch it in order to heal? Well, sometimes we all get tied up in knots, especially if we watch news and, so that's basically how it works, really. It's the same thing as holding a stubbed toe.
Yeah.
Yeah. And, but it could be a 30-year-old chronic illness. I've had a lot of headache patients and most of them get a lot better. Some of these people have had migraines since they were kids, and they're like in their 50s or 60s. And then finally something comes along and helps.
So yeah, that's really good. And I love this because what I hear you talking about is something so specifically natural and organic to just being human. And what I hear you saying is gentleness and softness and not forcing anything. So let's dissect a little bit more about what you said, because the simplicity of it, sometimes simplicity becomes where it's not like, oh, that's not that sophisticated. Actually, I feel like in the simplicity about what it is you're talking about is a ton of sophistication. Whereas we try to create a lot of complexity to things, and we try to make it seem that it's sophisticated when sometimes in and of itself, it actually is just remarkably superficial. So in your simplicity about what it is that you just shared, I feel that there's a lot of sophistication. Let's break that down a
Quite
little
a
bit.
bit.
Let's break it down.
Okay.
So let's talk a little bit about it from like a neuro trauma based place. I think this is like really helpful for people to kind of get it. While
Mhm.
trauma is a real big word that's coming across these days, there's been a remarkable amount of scientists and um, folks that are academics, I would say, that have really come across to help give us language to things that we didn't quite understand before, that are sharing with us that these constellations of pain that we carry somatically, as that may be tied to something emotional or even of spiritual pain or something associated in cognition, has continuums in them. So physical pain can lead to mental, emotional, and spiritual pain as well, or injury. And mental, emotional, or spiritual injury can lead to a somatic experience of physical pain also. So it's a real recognition of the continuum of the body, mind, spirit.
Yeah.
And Chinese medicine is very helpful and useful for this scenario. Okay, so a lot of what we try to do in Chinese medicine, especially as you shared this newer 65-year-old Chinese medicine that doesn't have its roots, while we are trained in the classics, are not necessarily practicing what the old school classics were really offering. And what I hear you saying is you've tapped into a way of understanding Tui Na to another level that is not just about fixing and treating and healing, but being present and available, offering techniques like hold for what I've heard you refer to as spontaneous forceless release. So in the
Yeah, I don't call it that anymore, but that's not a bad name for it. Yeah.
yeah, and so that's how I remember you mentioning it. And so in the world of trauma, I think the word that that really helps is safety. We're providing
Mhm.
safety towards relaxation, shifting out from a panic state or a stress state or a body's experience of feeling unsafe or under threat. That
Deer in the headlights. Yeah.
yep,
Yeah.
and they're in this fight or flight or maybe in a freeze continuum
Yeah.
with a
Yeah.
sympathetic drive, and we're applying touch and holding to get the body into a space of feeling relaxed, shifting into a parasympathetic state, helping them get to, say, maybe what Dr. Stephen Porges would say, maybe a ventral vagal state where they're in a state of parasympathetic activity. The body is relaxed. And from that place, a facilitation of you as a therapist providing Yin Tui Na can be able to help support the body in a state of not only relaxation, but relaxation for helping to correct the injurious nature of blocked channels or incorrect flow of channels. So let's get into like the nitty gritty about that, because, you know, how would you start a treatment working with somebody? When does a
Right.
treatment actually start? When you
Yeah. I mean, yeah. As far as like the treatment, it's like once my hands go on, that can actually help bring them into that state.
Mhm.
And then once they start getting in that state, then their body is going to start assessing it, right? Because it's been too afraid to
Yeah.
assess the damage, right? I mean, that's
Right.
part of it. Maybe it thought that it can't, and this is just it's over. You know, who knows what? Or maybe it just distracted. You know, who knows? And you know, the body's a little bit complicated. You know, I mean, there's a lot of stuff going on in here. So, you know, and especially if you've grown up in a culture that doesn't teach that this is a possibility. This is a big part of it, right?
Yeah, right,
I
right,
can
right.
imagine. I mean, we've grown up in these, however dystopian times, however much dystopian it is, pretty dystopian times. I mean, we're so cut off from nature. You know, I mean, I'm not saying there's not some good things. I mean, everybody loves a little Disneyland once in a while,
Yeah.
but
I mean, I believe it. The
but
happiest place on earth, right?
what's that?
The happiest place on earth.
Happiest place on earth. That's so sweet. And yeah, I'm sorry, I lost my place. Yeah, so I was talking about where was I?
Yeah, so you're talking about helping that even in a touch where we've sort of lost a relationship to be able to be connected to our bodies,
Right,
connected
right,
to be
right.
able
That
to
they can even
feel.
start assessing. Right, yeah, because that can just calm somebody. You know, when you're really like, oh my God, oh my God. And the right person has to be the right person. Can't just be anybody coming up and putting their hand on your back. It's got to be
Yeah.
somebody who knows how to do it. Again, we're even in those kind of situations, we're addressing what you talk to as the complexity within what sounds and looks really simple, right?
Yes.
Especially my style, where it doesn't look like I'm doing anything. Most of the times my hands are just in the same position, maybe moving a little bit.
Yeah.
And then sometimes there's more movement. Sometimes there's quite a bit of movement. Sometimes there's quite a bit of pressure, but never more than needs to be. And it's like a conversation,
Yes.
you know, like if I just was speaking very robotically right now, you guys would be so bored that you would have already turned on onto Amarama's next podcast. Right?
Yep. Yep.
Right. But so it becomes a language. It's like music.
Mm-hmm.
I mean, there's not enough time being spent because there's no time being spent in acupuncture schools talking about how the original characters for music and medicine, I've got them on my phone here conveniently.
Yeah. Oh, yes.
Right?
Wow. Yes.
Yeah. I'll have to keep pressing that button, but
Yeah. I mean,
so these are
character.
the original pictographs from Chinese medicine. The
Mhm.
one for music probably came first.
Mhm.
They look more like pictures now, but even the modern Chinese characters are based on these original pictures.
Yeah.
So music looks kind of like a person dancing, right?
Yeah. So tell me a
With their
little bit
arms
about
up in
that
the air.
experience for you. Like, what does that mean to you when you see those
Yeah.
those pictographs and these characters of really ancient Chinese text, and you see music and medicine being so similar? What does that mean to you?
Well, look, medicine is the same character as music,
Mm-hmm.
right? It's the same character, and it's just got those two little things over there.
Mm-hmm.
Which, interestingly enough, people say, "Oh, what are those things?" And I usually ask them what they think it is, and people will usually say something like something evaporating or flying off or going on, which sounds pretty accurate. On the internet, it says that they mean herbs, but I wonder if that's like a watered down.
Sure.
It's probably I'm guessing it's a watered down thing. It might have actually come from that, and it might mean herbs now, but I think originally it probably didn't mean herbs. But even if it did, that's okay. Yeah, for years, I got back into, I've been playing music most of my life, but I got really back into it quite a bit in 2008.
Mm-hmm.
And then by like 2010, I don't remember, you graduated in 2010, right?
Yeah, 2011 actually, yeah.
2011, okay. So maybe I might have started using a lot of music metaphor by then, but certainly the next 5 years after that, before I stopped teaching at Five Branches.
Yeah.
And now, a lot, I started using increasing amounts of music metaphors to describe lots of different aspects of the Chinese medical theory and the Tuina and the acupuncture. Yeah. And then I got to the point where, I used to joke around a lot, and you could kind of tell my classes, because it would be where all the laughter was coming from, even in the clinic. I was kind of incorrigible that way, but at least everybody had a good time. And I think that's helpful for learning and healing. But one of my bits was, here I go again, talking about music, you guys probably think I'm crazy. And then when I was getting really quite fed up with teaching there, one afternoon I was leading a internship at Five Branches, and all of my interns were in the treatment rooms with their patients. Mm-hmm. And a friend of mine who's really good at martial arts, and we talk about this stuff all the time. Mm-hmm. Super, we just have these great conversations. It's nice to have somebody you can actually talk with on that level, who's not going to get like offended or, and has some experience from the other mountaintop they're on, kind of thing. It's just really fun. And we're like, what can we do? What can we do? And, but anyway, so he sends me a text message with that exact meme of that one that I have on my phone right now. And he's like, here, I thought you might want to see this. And I was like, look at that.
Yeah.
I was right all along. No wonder those are the best metaphors.
Sure.
I mean, when they were trying to come up with a picture, like they were coming up with a written language, right? And they were like, okay, what can we use for this? Well, it's got to be music. I mean, it's just music. Okay, we'll put music and then we'll change it. It's like, it was obvious. That was the word they chose.
Yes.
You understand? And if we're not in touch with that, I don't know if we should be practicing medicine. I mean, I don't know if I really want to see anybody who's not doing all that, who doesn't have some kind of sense of this. You don't have to be able to play a instrument, but are you listening? That's the biggest part about music, is listening.
Yeah.
And that's what I say in a word. If I have to tell you what in one word, what I do with the Tuina.
Yeah.
Listening. Yeah. And because this is where all that higher level or complexity type stuff comes into play, is because I don't even know all of the input that my body's getting from the patient's body. I don't know all of it. I have no idea of all of it. Are you okay?
Yeah, no, I got all sorts of tech issues that are happening all of a sudden. And so, no, but you're flowing good, man. I really appreciate where you're going. Keep going with it.
Okay. Yeah. I'll go with it.
Yeah.
So where exactly was I though?
Well, you're talking about this relationship of harmony and music associated with this. And that's actually the kind of the direction that I wanted you to really take this in, is really a deeper force of understanding, like, okay, so you're talking about medicine and you're talking about music and how this kind of connects into Yin Tuina. What I want you to share is, so in an experience for somebody who's receiving Yin Tuina, how does that actually unfold, and where does music kind of come in for it? Because it's not that you're actually playing music in the room, but it's this harmonization, this sort of deep listening that I hear you.
Yeah. So the body's vibrating, the vibe, even modern science, who likes to dismiss this kind of medicine.
Yeah.
They've got instruments that measure the electromagnetic fields of the different organs of the body.
Yep.
All kinds of stuff, right? There's rhythms in the body, right? The heart. These are just real obvious ones.
Yep.
Wow, your whole background changes. That's cool.
Yeah. Well, just as a side note, I'm at my parents' place and I'm visiting with them right now. And so I didn't like the background for any of it. And, it's just like a bedroom where I'm kind of staying in. And so I had my wife take a picture of my office in my home for me.
Okay.
And so I just set that background as it is, because it makes me feel like I'm comfortably in the space where I'm like in my element.
Okay.
And so this is what's happening, but there's all sorts of tech issues that are happening behind the scenes here, but it's all good, man. We're just working with this.
No. Yeah. It's great.
Yeah, man.
Yeah. But it's really all medicine.
Yeah.
It's all music, it's really all music. I could talk about any perspective on a given treatment, including the interview, and just elaborate about how that's music. What's music about that? It's like, really a better question would be, what's not music about that? The word music means mother of all sciences. Kind of interesting. Music is an art form that's there. If we don't have a recording of it, right? A recording is still a recording of a live performance, unlike a painting, right? Or something that's, it's created, and that's what was trying to be created. Whereas music, the word is evanescent. EVANESCENT, probably something like that. But evanescent, it means that it appears and then it's not there. It's there and then it's not there. And then we can get into like quantum theory, right? The whole, that whole idea that a particle is there and then it's not there, and then it's there and then it's not there. Really interesting. Somebody who studies that kind of stuff told me a couple years ago that they actually there's some physicists think that it's even more accurate than saying that the particle is there, then not there, then there, then not there, to say that it's both there and not there
at the same time.
Yeah, well, because then you're bringing time back into it when you say at the same time. See, right? So that the particle is both there and not there, So this is really the quality of life all the time, even though we have our concrete stories about what things are and what, how they're going and everything, whatever. That's all good. That's just part of life too. But the fact is that, within it, there's this play, and we could look at everything as energy. Again, they've got microscopes that reveal that everything is really just protons and neutrons and electrons, this kind of thing anyway, light. And so that's really how, that's just the beginning of bringing, the music thing into it.
Well, it's really beautiful.
But also
the theory of Yin Tuina and kind of getting into that. And sorry, you were going to say something more?
Did you have a question? Or?
Yeah, I was going to ask how it is the person who's experiencing Yin Tuina, like what does a treatment actually look like, and if somebody were to come to see you and say, hey, yo, Chris, I heard you on this podcast, or, I'm in visiting Santa Cruz and I'd love to be able to get like an exposure to this form of treatment that you offer, recognizing that it has an impact towards feeling better and opening up areas in our life that, while we might get treatment from disease, but there could be opening of insights and awareness and areas where energy may be blocked that give us kind of like an opportunity or a window of an expression that may have been blocked for us for a long time, just because the channels themselves haven't been able to flow functionally. So there's a lot of experiences that can happen that's just more than just physical treatment or internal medicine treatment that can be able to provide profound levels of relaxation in the body that create insight and creativity. So, somebody who might be interested in wanting to participate in this, what might they feel? What would a treatment actually look like? What is it like for you?
Okay, so yeah, that's a good question. There's a bunch of questions in there. So
yeah, let's start with somebody.
So
who's
what would I tell?
Somebody who's kind of coming in for the first time. What would a treatment look like to them?
Yeah. So they would come in and they would tell me what's going on. I would ask them questions about their situation. And if they just wanted to try it out, I'd just ask if they have any other health conditions or old injuries or, aches and pains that tend to bug them, or most of us have something, something or another going on. Mm-hmm. But I could just give, a demonstration. I could even create, that's not my style to like create something and repeat it over and over and over. Mm-hmm. Although I do have some ritual, I'll call it ritual, but just things that I do just to help myself, like Rafa Nadal playing tennis, like putting the water bottles just so,
Yep.
But then that's so he can just do his sublime thing, Yep. So that's how I try to, and for me, I'll just say this much from my perspective. I'm always learning about this stuff. When I teach even beginners, I start off by telling them that I'm not interested in them like copying me so much or even repeating things that I've said. I really want to teach people how to learn.
Yeah.
Because that's another thing that our standardized education system really kind of has. I mean, you can't blame humanity. We've doubled or nearly tripled our population in less than a century, right? It's hard to keep up with all that. But, this thing about how to actually learn something and keep learning.
Yeah.
I quote a lot of musicians as well because they seem to have a certain perspective. And one of my favorites to listen to are interviews of Miles Davis.
Mm-hmm.
He talks about how, oh man, I just lost it. Sorry, I'm a little bit nervous. Expanding big ideas here. But,
no, this is great actually, because
yeah,
you're talking about some really deep philosophical things that most people may not have a relationship to or an access to for somebody who actually lives it. So speaking about it and talking about it, man, that's just like, whoa, it can get vast for sure.
Yeah. Well, let me read you this. This would just be a good time to read. This is an text message from a good friend of mine.
Okay.
Who just read. Oh no, it's on my email. I'm sorry. But he just read a couple of these new chapters that I've written, right? And he says, "Oh, it's amazing. It's beautiful how the message comes through with your succinct prose about, ancient Chinese medicine and Tai Chi and tennis."
Yeah.
and Miles Davis, it's pretty funny. It's like, yeah, I'll use anything. That's kind of how I like to learn from whatever I can learn from,
Absolutely.
At this point in life, there's three things that I do. I do Tai Chi, music, and Tui Na. And sure, there's other things there too, like acupuncture and, whatever. But it's mainly, those are the three main categories. But for me, they're all the same.
Yeah.
Although they are different. And I say sometimes I'm bummed out that the thing that I'm the best at is Tui Na. Uh-huh. And maybe someday my music will be as mature as my Tui Na.
Yeah. Yeah.
That's fun, huh?
That's totally fun. Absolutely.
Right. Yeah.
I mean, what I hear you saying that I think that is actually really helpful for people, especially associated with this concept that we're talking about with at least this podcast where we're kind of dealing with is dying well, living well, is a really great book or a philosophy of Zen mind, beginner's mind. This humility in learning and in education and growing ourselves and recognizing that we're never really stagnant or stationary. And you've been teaching this stuff for so many years, and you have students who learn from you and people who are trained in acupuncture and Chinese medicine that take this on to being a business model and a treatment model that they want to incorporate. And yet you talk about this cultivated art. And so, when we speak about like lifestyle medicine, where we utilize things that bring us into harmony, things that bring us into balance, into well-being, that allow for that. Creativity is just one of those places I think are like the unsung hero of our lives that bring a lot of vitality and joy to who we are and how we can have that expression. And it sounds like in your ripe age of youthfulness that you have found things that you really cultivate that bring that spontaneous experience of, I would say, almost a spirituality through creativity, music, Tuina, Tai Chi. And that's really amazing. And you're getting to such a level where you've cultivated it that they're not separate elements within your life. They're this kind of ebb and flow that feed into each other. And in that feeding into each other, that one makes you a better practitioner for a professional work that you're doing, but also as things that you utilize as a personal practice of meditation and growth, and also in a creative expression of art through music and wanting to grow that. I think that lifestyle that which you're talking about that cultivates this creativity that serves into your profession is actually a really beautiful synchronization that I think is just really powerful for people to know about, people to hear. Because when you go to a doctor, they may study journals, they may read up on the science, but are they reading up on their skill sets to connect? Are they reading up on their skill sets to develop empathy? Are they developing the skill sets of listening so that they hear not just the diagnosis and the algorithm to diagnosis of a treatment, but really finding a way in which, who is this human? What is it that they're really needing? How do we cultivate a relationship to making them feel better based on the goals that they have, as opposed to something that you're imposing upon them, right?
Yeah, I have a patient, she's got achalasia. Do you know what that is?
No, please tell me.
It's like, it's not a hiatal hernia, but it's where the hiatal sphincter it's squeezed shut and it won't let go.
Okay.
And so she gave birth about, I guess, a year and 3 months ago. Mm-hmm. And everything went well. It was natural childbirth and everything, but she developed acid reflux. Mm-hmm. And it kept getting worse. And it kept getting worse. And then a few months ago, she's the daughter-in-law of a good friend of mine. And so they gave her my number, and she's been coming in for about a month now. Mm-hmm. And she's within like the first week, actually after I think the first treatment, she already had at least the 30 or 40% improvement.
Yeah.
And she had already seen a bunch of doctors and they weren't really sure, and maybe hiatal hernia, blah, blah, blah. And but then she had another appointment. I can't remember whether it was an x-ray. It was something where they were able to diagnose the achalasia. Mm-hmm. And they found out that it wasn't actually a hernia. In other words, that hadn't gone up through the diaphragm, but the valve itself at the end of the esophagus, even though it hadn't gone up through into the chest cavity, was still in place, but that it was too tight. So they were telling her that, that there's treatments for that. And you know what they do? They cut the muscle so that food can go through it. Yeah. But she was telling them, I've already got it. By then she had like over a 40% improvement, right? And now it's over 50. She's kind of plateauing now, but every time she comes in, she asked me about, like, I feel like I did one of these podcasts already today, because she was my patient that I had right before doing this with you. And she asked me to send her my chapters and everything. And she's like, I want to come to one of your workshops if you ever have them, when the COVID thing calms down. And I only have 4 students when I teach now. Mm-hmm. Man, when I quit 5 branches, I was like, heck with that. Can we say heck? We can say heck, right? We can't say screw though, right? Heck with that.
Say shit if you want.
You can say. I was like, heck with that. I'm going to teach the way I want. And that means I can't have too many students.
Yeah.
Okay, am I really not doing this for the money? I mean, sure, I can do bigger classes. I've done a lot of bigger classes. But, at more than 20, it's like, how can that be? I guess it would be okay. But I have 4 students in the room, right? I'm giving the classes. Really good energy.
Yeah.
And but yeah, she's going to go in for, I can't remember what it is. It's kind of like they go through your nose and
Mhm.
they're going to investigate the whole esophagus just to see and what's going on in different parts of it and all this stuff.
Mhm.
And she was really nervous about it. And I talked to her about how it's not their fault, the people that are giving her this advice, the doctors, basically, right? It's not their fault that it comes across this way, but a lot of people feel like they just have to do what the doctor says.
Yeah.
That's what you were talking about, right? That they have a planned thing. And I was like, when you're going through it, just keep reminding yourself that they're not thinking about you, and don't take it personally.
Mhm.
Right. And then she came in the next treatment, and she was like, that was so helpful.
Yeah.
When, I've been thinking about what you said, and I was like, oh my God, what did I say now? What was it this time? And she said it was that. And I was like, okay, good.
Yeah.
And, but yeah, that kind of thing. And I said, if you want to even set an appointment for like a 10-minute pep talk phone call,
Yeah.
the morning of or the night before or something like that, you just let me know. Cause
A little bit of
she's like, I know
counseling.
it's so important to, she's like, I feel like you just have to do everything that they tell you, and and you don't even know, you don't know anything. I mean, you just do what they tell you. That's what they do. They
Yeah.
send you to this guy and that guy, and
Mhm.
there could be a little bit more humanity involved.
Yeah,
They
sometimes some little bit of counseling sessions might be necessary coming out of a doctor's office, or at least a pep talk before going in. The funny thing about it is, I spend a lot of time with doctors, especially when I'm at the hospital, and
Right.
seeing the reality of primary care docs or hospitalists or specialists that are working, just to defend them a little bit on that side. The
Sure.
continuum is like, the system of medicine itself, it's so grounded in medicine, so grounded in science, and it's solid because the training is legit. I mean, if you have acute based needs, it's so important to be able to see a doctor
Absolutely.
diagnostics. I mean, we have grown so sophisticated in the work that they're doing, but
Yeah.
the system of medicine itself does make it very challenging for the physician or even for the nurses who are working, because, like at the hospital, it's a thoroughfare. You're not like, admit to discharge, we really want to getting them through no further length of stays that's necessary, insurance companies and the bureaucracy that comes in. Sometimes it's a scenario that while you're sitting with your doctor, so it's a patient and a doctor sitting together, they can't see the 26 invisible people that hands are involved with all of the transaction that's involved with the doctor patient visit, that is associated with the bureaucracy, the paperwork, the insurance, the finances that are going involved with it. And those layers actually create a lot of complexity that, for doctors to survive within a medicine that exists, sometimes we refer to that they get burnt out. And, burnout, I don't think is the correct word that be able to describe that. It's more of like a moral injury that doctors sometimes get involved with, because the system of medicine doesn't necessarily facilitate the effective process of spending the time, taking the time, like you're talking about, to really cultivate that relationship, and to have that humanity. And even if you were to do so, there's a sacrifice that you have to make, whether on your finances or within your business model and practice, to be able to do a 45-minute treatment or a 1 hour visitation with your doctor, as opposed to that 5 minute to 15-minute that kind of goes, because the insurance model doesn't necessarily facilitate and support that. So, the system of it really kind of creates a complexity that doctors have to sort of square peg round hole into that obviously has its effect and ripple, in terms of patients and what they're feeling and needing that pep talk. This is why I like really advocate for somebody like yourself, if somebody who may be listening to this or wanting to connect and you're in the Bay Area of California, that you may be needing surgery, or you may be needing something that is going to be a little invasive, to maybe reach out to somebody like Chris, or somebody who provides a service like Chris, in terms of a harmonic or harmony-based treatment modality that allows for some natural energetic process to be incorporated. Because in that context, sometimes the disharmony or the injury is a disharmony to our relationship to our own body. And what I really love about Yin Tui Na, because I've practiced it for so long, and I've had a business model around it, and then I incorporated the same philosophy of it within my chaplaincy work and as sort of a trauma-based counseling, in terms of a rapport building and safety development. That what I found in that relationship, which is super sophisticated, is that we we have lost a relationship to feeling and connecting to our body. We are disconnected. And so just as the patient that you had talked about who feels disempowered to have a voice within the treatment process with her physician, and the challenge of that is a scenario that I think that we as humanity, we as people have also lost it, culturally, socially, we've lost a connection to our body. I mean, diabetes type 2 is a leading cause of disease and complexity within our culture and society. And it's the effect of the land of plenty, but inability to absorb. I mean, on a spiritual level, diabetes is just like, what? It's a first world massive issue in terms of type 2. And so,
Yeah.
In a mindfulness based practice, and like you've talked about with Zen, coming into a relationship of feeling the body, feeling the relationship, what I hear that you do within Tui Na, by holding at specific areas of the body without providing a lot of force, but the right kind of pressure, the right kind of touch, the right kind of support that may be necessary. What I hear is happening is drawing the person's also attention. Not only is there relaxation taking place that provides that parasympathetic response, but that there's this attention of the patient, the person receiving it, attention goes to that area. And so if you're holding from underneath the back, underneath the heart, and holding the spine upright and giving this, like this deep support that allows the heart to open, that gives some stability to it, where there's these deep emotional and almost spiritual points on the back, on those bladder channels. I mean, it's just so powerful that is also drawing the attention of myself as the patient, or another person as a patient, to that area, that gives them like, oh yeah, that area, oh, that feels so good. Oh, that feels right. Oh, that feels like that hurts, but in a good way. It feels that I haven't really paid attention to that area before in my life. I didn't know, but I came in for shoulder pain. You're working on my back. And by doing that, it's helping to release tension that I'm feeling elsewhere. And it gives this moment of like relief and relaxation. And I think that not only is it therapeutic in the context of what it is that you are providing, because I know that you would never take that power. You're not the one that's like, I'm doing the work. It's more like drawing the attention so that the person who's receiving it is like, oh yeah, there's my body. Oh yeah, this feels good. Oh yeah, some support, some oxytocin here.
Yep. And I think a lot of that happens like it's not cognized while it's happening. It sort of happens maybe because it's happening so slowly. Again, if I'm not forcing it, if I'm only pushing the person to those, it's almost like there's pain thresholds,
Sure.
Or dissonance thresholds,
Yes.
In the tissues,
Sure. Yes.
or the energy body, if there was one that exists. I'm not sure. We'll have to ask scientists about that.
Mm-hmm.
But I'm so bad. Hopefully you guys have a good sense of humor if you're watching. I really hope so, because I would really love to watch. I would really love to work with you, all of you, scientists and the MDs. That's what I'm really waiting for right now. But anyway, just to stick on topic, that I think the body untangles these knots. It's kind of like when we're asleep, all that stuff that happens, there's so much, they don't know. That's one thing that scientists will acknowledge, is they don't know anything about sleep. Like, they're clueless about sleep. They know a little bit, they've got some ideas, but like, what is sleep? Why do we need to sleep? Obviously there's some maintenance that happens, because we can see what happens when you don't sleep.
Mm-hmm.
Right. But you don't necessarily have to go to a therapist every day in order to get, if you're getting good sleep, you're kind of processing the previous day's stuff and whatever long-term stuff that maybe has bigger. This is another music thing, right? There's like the measure, and then there's like 4 measures.
Yeah.
That's another segment that repeats, right? This whole thing, usually it's based on 4s in most music, but you get the idea. The repeating patterns that intersect, and that some are bigger than others, right? And so I think that a lot of times, a lot of stuff happens along those lines that you're talking about, and the person isn't even aware of it. They just feel a whole heck of a lot better after, and their life will change in different ways, because those knots that might have worked with therapy, I've had a lot of people, lot of people have come to me, and they still might go to their therapist, but they say, this work is like even better than therapy as far as my anxiety or my stress or my this particular issue. I don't know how does that happen, they say. And I'm like, don't ask me.
Yeah.
But it's pretty cool, right? Because in Chinese medicine, we would just call all of that like liver qi stagnation, and then
Sure.
anything stemming off of that, right? Like
Sure.
heart heat or,
Mhm.
phlegm even,
Mhm.
Phlegm is a real interesting category too, because I think, in Chinese medicine, we have substantial phlegm and insubstantial phlegm.
Mhm.
Yeah, and substantial phlegm is um, mostly in the lungs,
Mhm.
right? We'll just say phlegm that we're all kind of familiar with. We've all had lung infections. So the phlegm is wrapping around. First of all, phlegm is not living tissue, okay, right? Because it's just, and it wraps around the pathogens, right? It surrounds the pathogens, and then so you can cough it out.
Mhm.
Yeah. Right. And then we have insubstantial phlegm, which means there's no substance to it. And that's all emotion related, right?
Yes. Yeah.
Mental, emotional trauma, right? That's kind of created this, they call it phlegm misting the mind, right? Creating like a mist. So it's not clear. It's starting to become a little less translucent, right? The vision, right? Because somebody's occluded by phlegm, right? Even though it's not substantial, it's not a substance, but it's acting like a substance, right, in the mind. Well, I think that scar tissue is, it might be useful to look at scar tissue as phlegm,
Mm-hmm.
because it's not living tissue, it's mostly collagen. And, well, I'll start from this angle. If you put needles through scars, okay, scar tissue, it's like, okay, you get a slice, you get a cut, like a C-section incision scar, okay? Most of the time, especially because it's not just the skin that was cut, right? It was all of the layers all the way down to the uterus that were cut through, right? So there's muscle layers worth of scar tissue, right? So there's all this stuff. The body creates this super glue,
Mm-hmm.
because we need this stuff back together as soon as possible. So it creates the super glue, scar tissue, okay?
Mm-hmm.
But scar tissue prevents the flow of energy because it's kind of rubbery, right?
Mm-hmm.
So that the energy flow, people who, if you get a little bit of sensitivity, you can kind of feel where there's more energy and less energy, and sometimes what direction it's kind of moving in, or whether it's staticky or chaotic or smooth, like a river or whatever, and how strong it is, all these things. Well, often at C-section scars, and this might be related to a lot of postpartum depression cases, especially ones who have had C-sections.
Oh, that's so interesting.
Yeah, right. Because, and I'm saying it's also like phlegm, because it's just sealing it off, seal it up tight, but then it's not functioning well. So it's kind of misting the mind a little bit in that way, right? And it's not able to flow, the energy is not able to flow through those meridians, which is going to have eventually other health problems that might not even be really seem at all related in terms of like the organ systems of the body, right? From a Western medical perspective, related to how could that be related to a C-section scar, right? But if you put needles through those scars, the energy almost immediately, in most cases, very easy fix.
Mm-hmm.
The energy will start flowing again. And if you keep needling scars, the scar tissue, even the first time that you needle a scar, afterwards, it almost looks like where you put the needles in, the scar is a little thinner. Like we'll just take a classic incision scar that's long and thin, right? Mm-hmm. Where the needles were, it almost looks like a string of sausage links now, because it's a little bit narrower where the needles were, right? So the body metabolizes the temporary superglue of scar tissue, phlegm, but the body can also, when you stick a piece of metal through, or massage can also work. I've been working on some people with massaging, but it's a little bit more vigorous. It's, it's still small and I'm not causing too much pain, but really just kind of sort of breaking it up. And then the body metabolizes that. And then there's no scar tissue anymore.
Yeah.
Like the phlegm that can theoretically be coughed out or cleared from somebody's mind.
Yeah.
You know? I find that that's pretty interesting. So that goes along with what you're saying. Can I tell just a fun story along those lines? Because I think
Yeah.
probably people listening to this are finding this probably interesting, right? But to
Well,
you and me,
I want to take a step back here because I think it's
okay.
important for people to recognize that in the Chinese
Yeah.
medical theory and philosophy, right, we have phlegm that, like we were talking, let's just like unbind the phlegm conversation here because it's super interesting. But to, you know, bring in a little bit of the steps to that ladder that I think Chris is really talking about in a real profound way, is that obviously we all have the inflammatory response that comes across from any upper respiratory infection that might have phlegm that comes in with it, that cough up, that gag, that mucus kind of experience. But in Chinese medical theory and some of the concepts around mental illness, they refer to it as elements of dampness or elements of being fog, like a mental fog that we have. So mental fog in Chinese medicine have varying layers, and this insubstantial phlegm, this invisible phlegm, is kind of like that concept that we refer to as, in very basic vernacular, this mental fog. Just to go a little bit further in that context, a lot of aspects of where mental illness associated with Chinese medicine in a lot of old school based thought had to do a lot with possession. So in the context of feeling possessed or feeling like you need a medicine person to be able to alleviate the person of an evil that's happening within their body. If we bring that into a little bit more of a modern context of understanding trauma, then it's that element of where we have this insubstantial phlegm that's causing a cognitive or an emotional or spiritual injury that makes it so that our reality is out of focus, where we are disconnected, that perpetuates this, what we were maybe diagnosed in a DSM categorization of mental illness, a depression, anxiety, schizophrenia, psychosis. And what I hear Chris really talking about is through therapeutic techniques that he utilizes in Chinese medicine, incorporating acupuncture, but obviously Yin Tui Na, is that there's ways in which we don't quite really understand the components of the microsystem, macrosystem, energetic flows of channels, and how things that can block, like an ankle injury that's untreated, can have a continuum that leads to somebody with some sort of emotional block as well, or creative block, or spiritual block, or a cognitive block that leads to, say, something like a depression, anxiety, or lack of purpose or meaning in their life. And that even the smallest context of that can help really unfold. And so that the treatments can be pretty wide and vast. Obviously, that we're not trying to take people out of their own realm, that it's actually very simple and very basic, but it's opening up through relaxation, exercises, and Yin Tui Na based techniques to be able to help support this, that help alleviate this insubstantial phlegm. And so speaking about, possession and cognition, we understand now that, the psychosis that we're talking about or having a relationship to, we understand better now from the trauma vernacular, the trauma research that has been there, that people we know that when have high levels of cortisol because of amount of stress or injury to the body from whatever component that might be, that there may be a scenario where that cortisol level draws up, and that bathing of the neuroendocrine function in the brain of these hormones that are stress related or injurious to the body over a long period of time. Sometimes they could be as small but build up through your lifetime, or it could be something that's very active, like what we see on our vets, that make that amygdala very large, the hippocampus and the limbic system, or the relationship to that prefrontal cortex, all dysregulated, to make it so that our bearing to reality, or bearing to safety, or bearing to feelings of threat in a conscious way are really off put. And so then the body and the brain mechanism is shifted, that perpetuates feelings of stress, anxiety, or even further levels of feelings of trauma or feelings of mental illness that might be associated with collagen being developed in certain areas that don't allow flow because blockage of energy.
Wow. Could
Maybe
be.
that's a long leap there, but I hear that there's a thread of that level of conversation, because that concept of a woman who's just given birth by C-section, who has an incision that may lead to postpartum depression, is super interesting. And I'd want to kind of get into the research a little bit to understand, is there a
No, I haven't looked it up, but a real simple thing, like one of the first
Please.
stats that I'd be curious about would be, do most, what's the ratio of postpartum depression cases to women that have had a C-section?
That's right. That's
I
right.
wonder, it seems like it might be higher, and that would make even more sense, because there's like major meridians that are being blocked off right here, like this one that goes up the center.
Yes.
That's one of the two main ones in the body, and then there's one right out from there. It's usually blocking at least 5 meridians.
Yes. Yeah. And especially if the body is experiencing it as something that requires it to be stabilized through scar tissue, that then leads to a space. Now, some people might not have it. It might be like, oh, it's just a small incision. Body's like, oh, this is not a big deal. But for other people, their experience of an incision like that, or any kind of surgery, and this speaks to surgery overall, the invasive nature to surgery and how the body responds to it afterwards. And I've worked with people who've had implants placed or knee replacement surgeries, and they've had metal, titanium, screws, bars placed into their body, and their body has reacted very strongly. There's a huge amount of infections, body increased with chronic pain. So you get a hip replacement surgery to try to treat the pain that you had before. Scar tissue had built up. The knee replacement takes place. They replace the whole hip. The hip replacement. And then the body is just like overwhelmed by this new foreign object placed there, and new forms of pain, new forms of chronic injuries that come up that require physical therapy, sometimes multiple surgeries that come in. And it becomes very complex when overall there's maybe something a little bit simpler, and maybe even simpler techniques that have sophisticated elements to it that could be very effective.
Yeah, see, this would be a really good time, because you've asked several questions that are all being tied together with this about the yin tui na. So with my approach, because I'm not trying to make anything in particular happen at any particular rate,
Sure.
that gives it's like, if the person's healing system, whatever that is, whatever is involved with healing, is not really that well experienced or trained, it's almost like that gives it a training session.
Yes.
Because what I'm leading to is that eventually it's going to start assessing the problem, like we talked about, right? It's going to say, oh yeah, I didn't even realize this was here. And it might not even be cognized. I think most of the time it's not cognized. The person might notice some sensations, but this whole thing it's very much like autonomic type thing.
Yeah.
But that, oh yeah. So with my approach, like say there's multiple, like say in a long-term kind of illness that's got to recover, and there might be injuries involved, or maybe there were surgeries as well. There's like there's a lot of things that need to heal up in there, a lot of knots that need to be untied, and a lot of cooking, like incubating and cooking, I call it, just to use some vernacular terms, to really help it to become more balanced, return to a balanced state. So the body finds its way through those and knows what it needs next.
Yeah.
So it's like, through a course of treatment, I could look like I'm doing the same thing. Probably my hands, like if it was being measured by, scientific machines that could measure what's going on energetically, and in my body might be different, but I'm not trying to make any of that happen. I'm just blending like I'm playing music with a band that I really like playing with, or something like this.
Yeah.
And because the thing, it'll just say, okay, what next? It's like homeostasis. Nature, if it ever goes out of balance, it's like, okay, we got to go back to balance.
Yeah.
As soon as possible. I don't know if it's technically homeostasis, but it's at least close to the idea of homeostasis, right?
Yeah.
And each step along the way, if something's finally cleared up, it'll be like, all right, okay, now we got to do this. And then that'll start happening.
Yeah.
And a lot of this I call incubation type tui na. It's not like there's not really too much blockage going on. It just needs to cook. And it's just sometimes even that stuff can happen better if it's got a good set of hands on it.
Yeah.
than without. A lot of the stuff that doctors send people home, and again, I don't mean to knock doctors, and I agree with you fully on the usefulness of Western medicine. This is not a replacement for Western medicine.
Mhm.
Maybe it might be used earlier than some of the Western medicine things that are now for, higher up on the flow chart, right?
Yep.
This might be implemented, at some point, but
Yep.
I'm not trying to replace anything or get people to replace anything, but things that they'll send people home, like after they put a cast on your broken leg, right? They'll send you home. Or after a surgery, you've had general anesthesia, they'll just send you home.
Mhm.
Now, that broken leg, sure, it's probably going to heal in 8 weeks or however many weeks it takes. But I've treated a lot of broken bones, and some of my students have treated broken bones too, and they always heal faster than you would expect.
Mhm.
And I've even treated some shattered to bits, large bones in the body. One patient that was in a head-on collision with a 18-wheeler
Yep. Oh, wow.
survived, shattered scapula, humerus, and femur, the big thigh bone.
Mhm.
And I treated him for 5 days straight. I had to fly across the country, treated him for 5 days straight after he had already been in a drug-induced coma. I think he was in a coma already, and then they kept him asleep because it's too much, and he had a traumatic brain injury. They didn't even know if he was going to live. It took like 2 or 3 surgeons over 24 hours to put all those little pieces back together.
Wow.
Right, bones, yeah. But I only treated him, no needles, just these 2 suckers right here. I was there for like 6 days, 5 days, I guess. I treated him for a little over 4 hours a day
Mhm.
for 5 consecutive days. And just to make a long story short, there's a little bit more. He got released from the hospital the day I left, which was day 13 after the accident. And they were expecting to not even be able
Wow.
to assess him. They were expecting not even to be able to assess him enough to transfer him to an inpatient rehab center. Forget about transferring, not even be able to assess him for at least 30 days.
Yeah. Yeah.
Okay. But they released him after day 13.
Yeah.
And then he just did 2 days a week of outpatient rehab.
Yeah.
And he said that every time he got a new physical therapist at the rehab place, they were like looking at his chart and like looking at him and asking him if this really just happened a few weeks ago, kind of thing,
Yeah.
They couldn't believe that he was in such good shape, right?
Yeah.
And then he ended up going back to work full time as the head chef in a fast-paced restaurant kitchen on week 13.
Wow.
That's pretty remarkable, and he was already walking around. I mean, before I left, just shattered bones, right? Plus he had a bunch of other broken bones in his leg and his ankle and stuff like this. But he was like wanting to walk in the hospital, not really, but he was like getting impatient with the nurses if they wouldn't come help him, make it over to the bathroom and stuff.
Yeah.
So this stuff works pretty amazing for broken bones.
Yeah.
For a lot of things. So that's one thing where they just send you home, right? A broken bone. Oh, it'll heal. Leave the cast on it. This stuff is not expensive at all compared to how much you pay for most medical procedures.
Right.
Right? I charge $130 for an hour here right now. This is 2020. My rates might go up soon. Yeah. Yeah, that. And and the other one was the anesthesia. Post-surgery, after you've been in general anesthesia, a lot of people feel really groggy for several days afterwards.
Yeah.
I've had a number of patients that have come in, and I just discovered this by accident because they had dental surgery or something, and I was holding the person's head. And afterwards, this is one of the first ones years and years ago, right?
Yeah.
And they were like, oh my God, I feel like it's so clear, like the anesthesia's gone. Come to find out, if I do that on anybody who's had general anesthesia, and they say that their foggy headedness clears up more than 50% just from one treatment.
Wow.
Yeah.
Yeah, because general anesthesia is pretty intense for somebody to go through on a regular, right? Like that's super intense to have a participation in.
To go through what?
General anesthesia.
Right. Yeah. Yeah.
That's a lot. That's a
But
lot.
that also gives people who are listening to this podcast an idea of, we're talking about brain plasticity here,
Yeah.
right? The brain's got some chemical in it, and when given a chance, it can shake it off. When
Yeah.
given, it's like when you have to go clean the gutters or change a light bulb that's really high up, and you've got that ladder, it's like you try to go up and it starts to wobble, right? So you got to get somebody to hold the ladder. If you get somebody to hold it and stabilize it, it's so much easier.
Yeah.
That's just one simple, metaphor for that.
I love it,
But
man.
that seems to be how the healing, how it really, I call it promotes healing.
Yeah.
It promotes healing when you put your hands on somebody.
Yeah.
If you know how to do it right. I mean, it's not much to it, but it's not like normal social touching. It's a little bit different,
Absolutely. Absolutely. Well,
Yeah.
I think we're kind of in that like zone of feeling out medicine and science. Obviously, COVID is like the number one thing that's happening in the world these days, and so much focus is upon that, and that's very much understandable.
Oh my God, I keep wondering, like, if I could work on people, even people who don't have COVID anymore, but have these residual
Yeah.
symptoms, I bet this could help clear them up so well.
And we're starting to learn about the chronic issues that are associated with people who've had COVID, and obviously we're not quite sure to map it all. And but there's a lot to be said about science and its innovations to be able to measure the energetic properties, which we're talking about here. And I know that you referenced that a lot, that if we had an opportunity, I keep thinking like Star Trek reality. You have tricorders that could read the body scans. I feel like they're reading the energy. They're reading like the life force energy, the prana of the body, and understanding where the issues are truly at, where the blockages are. And one of the things that we learned in Chinese medicine is because we're looking at things from such a macro lens, a macro perspective, as opposed to a micro perspective. Medicine is very much a post-diagnosis based treatment model. And so until there's something wrong with the body, then we get into the place of wanting to treat it. And so if there's nothing really wrong, but yet people have somatic experiences, or they're having, mental experiences about something that is happening with them that doesn't feel quite right, if we don't have a way to measure it, yet it's hard to really apply treatment for it. Whereas like Chinese medicine and Ayurveda and energetic based principles are understanding the subclinical approach to treatment. And so, if we have an opportunity,
Subclinical, I like it. Yeah,
yeah,
nice.
subclinical, like it's not quite diagnosable. Somebody may not have anemia quite yet, or in terms of their CBC and understanding their red blood cell count or hemoglobin or iron levels, particularly about what's going on with the body. But we can understand that there are certain mechanisms that we start to see, that there's maybe increased dizziness or blurred vision, or areas where somebody feels shortness of breath or a little bit lightheaded, or obviously, difficulty with concentration. We say, hey, and especially if they're a woman who's young, who's studying at the moment, then we can sort of see that the marker of that they may be blood deficient, a Chinese medical based diagnosis. They may be spleen qi deficient, or they may be, blood deficient within their constitution. We could be able to support that without them getting to that deep place of anemia, cyanotic, or something that's really complex for them that requires pretty profound intervention to be able to support. So like these components there are really helpful. So in regards to treatment and regards to all this, I mean, I think we've really got to know about Yin Tui Na. We learned a lot about Chinese medicine here. We've learned a lot about how you cultivate and how you be able to share not only treatments of Chinese medicine, but a really kind of taking it to another level. Whereas some people who may be listening to this may not know anything really about Chinese medicine. So we break it down a little bit, understanding Chinese medicine, acupuncture, that continuum, taking it to that another level of utilizing a hands-on body-based treatment methodology through Yin Tui Na, Chinese-based massage, but another level of this yin, this holding, this more passive sense about creating that extra support for them to allow the body to get to that place of homeostasis and treatment. While we're at the end here, I think this is maybe a good place to sort of like, take pause and sort of allow people to reflect. Is there anything else that you want to share? Anything else that you want to offer folks?
Well, I was just thinking one other brief thing just in general is that another thing that I really love about the Yin Tui Na is that, because I like to keep my navigational, sights on, thinking what impact is what I'm doing today going to have, 100 years from now, or 500 years from now, or 1,000 years from now.
Cool.
And one really cool thing about the Tui Na is that you don't need anything besides hands. You don't need herbs. You don't even need little needles. You don't need little massage tools or anything. It's just the hands. It's amazing what you can do with even just a little bit of treatment. I can get people doing really pretty amazing things as practitioners of this stuff. And you've got it wherever you go.
That's right. Yeah.
I think that's a really amazing thing, and I'm gonna start doing more writing about self-care stuff. I might publish about that as well, and maybe even have some like workshops and seminars more for the general public. Even though anybody could come to any of my workshops, it doesn't matter. Even my students know, the ones that have been studying with me for years, they still come to ones even if they're the only one that's not there for the first time.
Sure.
Because it doesn't matter. You can learn. It doesn't matter. It doesn't matter what level you're at. If you're in one of my classes, you're going to learn as though I was giving you almost like a private lesson.
Absolutely. So you got a book that you're working on that you're hoping to publish pretty soon?
Yeah. Yep. That's just the first Yin Tui Na one.
Mm-hmm.
And, just to kind of flesh it out. That's more of sort of a textbook a little bit, but it's like Obama called himself the cool president, right? So it's going to be the cool textbook. It's going to be the textbook you like to read,
Yeah, I get you.
Yeah. When you're taking a study break, you might crack that one open.
Oh, there you go. I love that a lot.
Yeah. And then after that, I want to write because I created that class at Five Branches, Essentials of Needling, which just taught you how to. There's all this talk about theory and needling techniques, but nobody ever shows you how to do it, and you don't get practice time,
Sure.
And at one point, the students asked me, just like you guys did, to give you the Yin Tui Na class, and that turned into a whole Yin Tui Na, curriculum.
Revolution.
In the clinic, the Yin Tui Na revolution, yeah. And so I want to write a book about the essentials of needling stuff as well.
Right.
And then I want to really focus on like self-care type stuff.
Yeah.
I'd love to give like seminars to the general public about that kind of stuff.
That's beautiful. How could people get in touch with you if they wanted to?
They can email me. They can check out my website, chrisels.com.
Okay.
And the email address is on there. It's info@chrisels.com.
Great.
And my phone number's on there too. Feel free to call anytime.
Yep.
And I'm here and giving treatments here in Santa Cruz. I gave up my Los Gatos office after several months of the COVID lockdown. Just for now, we'll see what happens. But it's going pretty good over here.
Yep.
And let's see what else. Oh, and workshops too. I've got people, including that patient that I just saw right before you, who's like I said, it felt like a podcast, and she's like, let me know when you're going to give a workshop. So maybe that will happen sometime soon, but we have to be real careful with the COVID.
Totally.
The COVID spread and all that stuff. But I'm free. I've traveled all around. I've done a lot of extensive work, including a lot of workshops, given a lot of workshops in Europe as well.
Yeah. And so
I travel.
Just to be able to touch base with that, because obviously it is COVID time and we don't know when this is going to end. And we're doing this in October of 2020. And so, not knowing where COVID is going to be post-election time and into 2021, how is it that is your practice in regards to safety, and for people who may be interested in learning more from you or receiving some of the work that you do, how is that in terms of a safety protocol?
Well, I'm having patients come into the office, and I just do one person at a time.
Yep.
And everybody wears masks the whole time, and I sanitize. This is what most doctors' offices are doing. I'm just following that same protocol right now.
Right.
And it's great because nobody else shares this office with me.
Good.
So there's only so many people coming in per day.
Yes.
And I always have, for years now, I've scheduled a half hour in between appointments.
Yeah.
So that gives the room, I've got this nice big window here, so I can just open the window and let it air out a little bit as well.
Absolutely.
But so it's good. If it gets real, if the numbers start going up around here, then I'll just take time off. I took 5 weeks off at the beginning. I'm real careful about that stuff. So I didn't work at all for the first 5 weeks of the lockdown.
Wow.
Yeah.
Wow.
And then the next 3 weeks were just like 3 or 4 treatments a week because people started calling me.
Yeah.
And they were like, can I get one? I
Seriously.
don't care. And I was going, to people's homes, and I'm still going to people's homes a little bit and doing outdoors. This great thing about living in California is you can do it outdoors.
Yeah.
Yeah, yeah, yeah.
Beautiful work, Chris. I really appreciate the time and,
Yeah,
giving us all the
great to
details.
see
So
you.
at this point, I think we'll cut it off. We'll hang out, I think, for a little bit of
Okay.
time here afterwards. But yeah, man, thank you for making the time and sharing your genius and your brilliance with us. And, simplicity is sophistication and simplicity. And I've always found that to be a massive trait that you offer for so many folks and obviously help me within the skill set of my work. And, just for you guys all to know that, Chinese medicine has been a big part of my life. And obviously I transitioned into chaplaincy, and I've had lots of conversations with Chris as he trained me in Yin Tui Na. And, I've thought about like, how does Yin Tui Na really effectively work if I'm doing it based in therapeutic conversations with people? And it's remarkable the effectiveness of the approach of this simplicity of supportive holding, and without even having to use hands, that could be so effective. And I've utilized these principles of harmony, harmonization, tuning in, connectivity with people in massively traumatic situations at the hospital. Obviously, I've shared with many of the folks who may be listening that I've worked in trauma one hospitals and worked in tense situations where people were facing profound levels of devastation, grief, and loss that were very abrupt. And so being able to have that opportunity of what Chris is. And so this is just, an podcast that's like an homage to Chris. And thank you for the training and the support and, the education over the years of bringing
Yes. Yeah, wouldn't have missed the moment of it, man. Yeah, great fun. Yeah.
Good stuff. All right. So we're going to stop here, and lots of love to everybody out there in the podcast world, and we'll catch up at another time. Bye.